Good day. I am Hazel Quimes Garcia and I'm looking forward to talking with you today about pandemic. Listen to us as we share some knowledge about COVID-19.
In this video, we're going to tackle the history of coronavirus. On December 31, 2019, World Health Organization was informed of case of pneumonia of unknown cause in Wuhan City in China. A novel coronavirus was identified as the causes by the Chinese authorities on January 7, 2020 and was temporarily named 2019 nCoV. Coronavirus are the large family of viruses that cause illness, ranging from the common cold to more severe disease. A novel coronavirus is a new strain that has not been previously identified in humans. What is coronavirus? Coronavirus are the group of related RNA viruses that can cause disease in mammals and birds. In human and birds, they cause respiratory tract infections that can range from mild to lethal. Mild illness in humans includes some cases of the common cold, which is caused by the other viruses, while more lethal varieties can cause SARS, MERS, COVID-19, which is causing an ongoing pandemic. Novel coronavirus is responsible for more fatalities than the SARS coronavirus. Despite being in the initial stage of global pandemic, the first suspected case in the Philippines was investigated on January 22, 2020, and 633 suspected cases are reported as of March 1.
Current situation of the Philippines. Our country latest update to COVID-19 pandemic this January 29, 2022. New cases is 16,884. Total deaths of 53,891. Only taken of one dose test taken. According to World Health Organization, the current situation of the Philippines as of January 3, 2022 to January 28, 2022, there have been 3,493,447 confirmed cases of COVID-19 with 53,736 deaths. And as of January 19, 2022, and a total of 122 to 321,531 vaccinated, those have been administered.
Transmission of COVID-19 occurs when people breathe in air contaminated by droplets and small airborne particles containing the virus. The risk of breathing this in is the highest when people are in close proximity, but they can be inhaled over longer distances, particularly indoors. Transmission can also occur if splash or spray with contaminated fluids in the eyes, nose or mouth, and rarely via contaminated surfaces. People remain contagious for up to 20 days and can spread the virus even if they do not develop symptoms. The 3C describes settings where transmission of the COVID-19 virus spread more easily. Crowded places, close contact settings, especially where people have conversation very near each other, confined and enclosed spaces with poor ventilation.
Symptoms of COVID-19 includes new or worsening symptoms such as fever or chills, cough, loss of sense of smell or taste, difficulty breathing, sore throat, loss of appetite, runny nose, sneezing, extreme fatigue, headache, body aches, vomiting, diarrhea. These COVID-19 symptoms can range from mild to severe. Sometimes people with COVID-19 have mild illness, but their symptoms may suddenly worsen in a few days and may experience hard to breathe, chest pain, can't drink anything, feel very sick, and feel confused. Go to an urgent care clinic or emergency department.
Patients of COVID-19. Other adults and people with certain health conditions have a higher risk of having a weakened immune system that can make them more likely to get severely ill or experience complications that may include myocardial injury, myocarditis, acute myocardial infarction, heart failure, and cardiomyopathy, arrhythmias, shock and cardiac arrest, venous thromboembolic, pneumonia, acute respiratory distress syndrome, or ARDS, multi-organ failure, septic shock, and worse, death. And that is all for the complications of COVID-19.
These are the safety protocols that we should adhere to. These have been recommended in public settings to minimize the risk of transmission. Follow this simple precaution to reduce your chance of contracting COVID-19. Always clean hand. Don't give COVID-19 a chance. Cover cough and sneeze. Protect yourself and others from disease. Don't touch mouth, nose, and eyes unless hands are properly sanitized. Avoid crowded place. Limit time in enclosed space. 1 meter away. Keep virus at bay. Wear a mask outside your home so you may safely roam. Open doors and windows. Breathe fresh as it let it flow. Stay at home if you're feeling sick. Seek medical care and act quick. Get latest news from trusted source. Fight the virus with these resources.
Medication for COVID-19. There are two types of coronavirus treatment basically. One is home treatment and the other one is hospital treatment. If one does not have severe symptoms, they can treat themselves at home most likely. It is similar to how you treat your cold or flu. However, if your symptoms keep getting worse, a hospital is recommended to get proper treatment. The doctor will be able to tell you better which treatment you must option for it. If a person has mild symptoms, they can easily recover at home following some steps. Firstly, the person must take proper rest. It will help in making you feel better and get a speedy recovery. After that, make sure you are staying at home. Do not go to your workplace, college, school, or any public place. Further, drink lots of fluids. We tend to lose more water when we are sick. If you get dehydration, your symptoms will only get worse and lead to other health problems. Therefore, drink plenty of water and healthy fluids like coconut, water, turmeric milk, and more. Most importantly, keep monitoring your symptoms. It is essential to constantly monitor the symptoms in case your symptoms get worse. Call the doctor first and let them know about your condition.
Thank you for that. I'm Jacqueline Lorico and my topic is about the agencies and hotlines for COVID-19 response. Here are the hotlines that residents can contact to in case they need help. The Department of Health has launched the DOH COVID-19 emergency hotlines at 02-894-COVID. Smart and PLDT subscribers will also be able to use the 15555 hotline for free. Callers can ask questions and information if they think they have been infected with COVID-19, or they can ask for help if they had symptoms or they know that they have been exposed to confirmed cases or patients under examination. And when it comes to mental health assistance, during the COVID-19 pandemic, UNICEF and the Philippine Red Cross enhanced the mental health services. The COVID-19 hotline 1158 is a national toll-free number dedicated to providing psychological first aid to callers. It has provided individuals with comfort and has assisted them in assessing their wants and worries.